Hi, this is Dr. Ira. It's our next installment of Practical Veterinarian, and we're going to talk about emergencies today. And we're just going to be a cursory list of things that are really emergencies and things that need to be seen ASAP. Some apply to the dog and cat, some don't. So we'll kind of just go down the list. And again, this is a cursory list, but if you think there's an emergency, then it could very well be an emergency. So you should always have it checked. If you think there's a problem, don't wait on it because there may be more of a problem than you think. And it's always good to catch it early, sooner than later. So that always works. So we'll start off with the dog. The dog and the cat both get pyometras. It's a uterine infection, which can be very toxic, and that would require emergency surgery. There's an open pyo where they're draining like a pussy material. There's a closed pyo where the uterus is like one big abscess, and that can get very toxic from that. So that is really more of an emergency. So if your unspayed cat or dog is drinking more water than normal, not feeling well, maybe some vomiting, you definitely want to get them seen sooner than later. One of the smartest vets I know, Michael Scher, who is at the Animal Medical Center, once said, "Never let the sun set on a pyo," and that's true. Closed pyos especially need to be taken out right away as an emergency surgery. The open pyos can wait, they can be stabilized, they're not as toxic, but you also want to check all the blood tests. So for a dog or cat, always good to, unless you really plan on breeding them and you're serious about it, you should get them spayed when they're young, maybe anywhere from 6 months on. The next emergency for a dog and a cat would be a dystocia, where they're pregnant and they can't give birth, and you'll notice that they'll be pressing their abdomens down. The water may break. If they're in heavy labor and they don't have a puppy or a kitten within 2 hours, that's an emergency. They should be seen right away, and they might need a C-section. They might not, but they should be seen right away if you don't get a puppy or kitten within 2 hours. Don't wait. If there's placental separation and the puppy or kitten dies in utero, the mom can get very toxic, and you could actually lose the mom. So try and do it sooner than later. Plus, you want to save the puppies and kittens if at all possible. And the sooner you get them in, the better you'll be. Both of them, again, for respiratory distress, if they're breathing heavy, they can't catch their breath, don't wait. Bring them right down, because the longer you wait, the harder it is for us to get them back. Dogs, especially brachiocephalic breeds, the pushed-in noses, the Frenchies, the bulldogs, the boxers, they do have problems breathing. And if it's over 80 degrees and a bit humid outside, they can definitely go into respiratory distress. So make sure they all stay in the air conditioning. If you want to take them out when it's cool in the day, in the early morning or late in the evening. But if it's humid, they go out, do their business, come right back in, and that's it. But as soon as you notice them turning blue, having trouble breathing, get them in. Both, again, for bleeding. If they're bleeding from someplace, they have a laceration. If profuse blood is coming out, try and put a bandage on it, a dressing, a pressure dressing on it, and let's get them in so we can get them taken care of ASAP. If they're falling over or having seizures, that again, they should be seen right away. Epileptic seizures, especially more common in dogs, usually finish within 2 or 3 minutes by the clock. If they extend for more than 3 minutes by the clock, that's status epilepticus, and you want to get them in so you can stop the seizures. If you let the seizures continue on, their temperature will rise, and you wind up with either brain and or liver damage. So you really want to get that under control sooner than later. If they have a seizure and they're out of it, usually in about 2 or 3 minutes, that can wait. If it keeps happening, then they want to get them seen right away to get them on some anti-epileptic medications. But you really want to make sure that anything past 3 minutes by the clock gets seen sooner than later. Trauma, if they get hit by a car, if they fall, if they get hurt by another animal or whatever it might be trauma-wise, you want to get them taken care of, because you want to make sure they don't have a diaphragmatic hernia, they don't have any lung contusions. You want to make sure that the bladder is not ruptured, and that's a big one, especially for trauma hit by cars. If the bladder ruptures, then the urine leaks into the abdomen. You wind up with uroabdomen and a very toxic animal. And the bladder needs to be repaired sooner than later, or at least get a catheter in there. If you get a catheter in there, it gives you a little bit of time, especially if they're very toxic and they're not surgical candidates at that time. But you should always get some x-rays taken. We always like to take x-rays of the pelvis whenever there's a hit by car, because sometimes they will walk with a fractured pelvis and you won't realize it. And you want to make sure that you get that under control. Some of them need surgery. Sometimes they just need cage rest for a fractured pelvis, and they will do very well. The toxins, if you think they got into any kind of medication, toxins, drugs, whatever it might be, we call poison control, especially if you know the toxin, and get them in ASAP. The sooner we can deal with it, the better off they'll be. And we do see everything from marijuana, methamphetamine, animals will come in drunk, they'll take grandma's cardiac medication that fell on the floor, a myriad of things. And if you do know what they got into, bring the bottle or bring the bag with you and hold on to it and call ASPCA poison control on your way in or before you come in. And sometimes they'll tell you not to worry about it, that it's not as bad as you think. Chocolate can be a problem, and we always have you call animal poison control, just because a lot of times we really don't have to see them, but they will tell you what the symptoms might be if we do have to see them. In dogs, we have gastric torsions or bloats. Usually it's in very deep-chested dogs. We've seen them in Dachshunds up to Great Danes and Mastiffs, Hound dogs, Boxers, anything that's deep-chested. Mostly it's the larger dogs. They will drink a lot of water, eat a lot of food. They'll be active. The stomach acts like a pendulum, and it'll swing back and forth and eventually flip. And then at that point, we need to surgically reduce the stomach into its correct position, and then we usually tack it to the wall, do a gastropexy, so hopefully it doesn't happen again. When the stomach twists, you wind up having a compromise of the blood vessels, and sometimes you can get a portion of the stomach that will actually have to be resected because it's dead. In our practice, when we were doing gastric torsions, most of them came in a timely manner. You can tell they're hunched up, their stomach is swollen. You can flick your finger on the stomach. It sounds like a watermelon. And we had a success rate of about 85, 90%, and which was actually very good. It's an expensive surgery if you have a deep-chested large dog, especially, and it's a female and you're spaying it. I strongly suggest you have the gastropexy done, where the stomach gets attacked to the body wall. If it's a male, you're getting him neutered. I would recommend it as well. It's a little bit more work because you have to open the abdomen up to do it. That's a little bit more post-op care, but in the long run, it'll save you a lot of aggravation and a lot of money. Gastric torsions are very expensive. The other thing that the gastric torsion can look like is a food bloat, especially in dogs. They'll eat their full of food, they drink some water, food expands in the stomach, and you wind up with what looks like a torsion, but it's really a bloat. And at that point, we have to really sedate them, get a stomach tube in them and flush them out. It's very painful. And a lot of times the stomach is so swollen that it pinches off the pylorus, which goes from the stomach to the intestines, so they can't relieve themselves that way. It will not pass. And it also pinches off the esophagus going into the stomach. So then it winds up getting gas filled, and it can be very painful. So that's another thing that should be seen right away. Another thing with dogs is reverse drowning. If your dog's in the ocean and it aspirates a lot of seawater, and it can happen in a pool also. The water goes into the lungs, the osmolality changes in the lungs, and even though they look normal after they have a possible drowning or almost drowning, 2 or 3 days later, due to the change in osmolality in the lungs, the fluid starts going into the lungs, and you have a reverse or dry drowning, and they can actually die from that. So if the vet says, it's suspicious and they want to keep them in oxygen, I would definitely keep them in oxygen for 2 or 3 days, just because you don't want to have the dry drowning. We've actually lost a few dogs from that. The other thing that the dogs and cats both get are blockages of the urinary tract system. In dogs, it's mostly due to stones. When they have the stones develop, it'll block the urethra, especially in male dogs. A lot of little stones can get stuck at the os penis or the bone in there, and the stomach can or the bladder can fill up, and then you can wind up with mechanical issues with the bladder. Sometimes the bladder can even rupture in some cases. Male cats, it's very common. If a male cat is running to the box and trying to strain and nothing's coming out and they're crying and they keep running back in, they'll feel their abdomen. If it feels like a softball in there, get them right to the vet. They need to be sedated and unblocked. A lot of times, if it's long-term, the bladders can be damaged severely. Can also get kidney damage. They get toxic. And you want to get them on fluids and flush them out as soon as you can. So we see it in male dogs with stones, female dogs with stones as well, so they can be blocked also. And it's really important if they're straining, if they're standing, like they want to urinate, nothing's coming out and they're crying, that is an emergency, get them right in. And again, with cats, occasionally with female cats, mostly with male cats, they have urethral obstructions. Sometimes there's actually a surgery where we make a he into a she. The urethra is much wider and they can pass all those little crystals, which is usually the case in female cats, which is why we don't see as many blockages in female cats. Sometimes a stone will get stuck in there. Let's see what else we have here. If a dog or cat is falling over, that's an emergency. For whatever reason, if they're seizuring, they'll be paddling their legs. But if they're falling over, if they have a head tilt, if their eyes are moving back and forth, which is a nystagmus, it could be anything from an emboli to the brain to severe seizures. And again, seizures with status epilepticus is past 3 minutes by the clock. So you really want to get them in if that is an issue. So those are a few things that you want to be aware of. It's very cursory, just kind of went over them. But if you have any suspicions of any of these things, you need to call your vet right away. If you think it's an emergency, it probably is an emergency. And I would go ahead and make sure that you call the vet and let them know you're coming in, number one, with an emergency, or at least talk to them if you're not really sure. Most of the times, if somebody had an emergency and they described any of these conditions, we told them to come in right away. Better to check them and not have a problem than not check them, and then you wind up with a real problem. So I hope this was helpful. If you have any questions, you can email me at drdvm@gmail.com, and I'd be happy to answer any questions you might have. I hope this was informative. Have a good day.